Whoops. Usually it says, but maybe my volume was off. I think your organization. Um, my name is Samantha Breslin. I'm the program supervisor here at the City Health Dashboard, and I'm very excited to be joined by my colleague, Yuman Wang, who will also be supporting me on this and can support you all as you play around with the data and play around with the dashboard and all of the features that we provide. So I will start sharing my screen and kick us off. So first of all, congratulations to all of the cities and the folks who actually applied on behalf of your cities to be included on our map. We had, a record number of people. Each year we do this. This is the third year that we've done it, and we get more and more cities applying every year. And the strength of the applications is just really astounding. And so this year we selected 51 cities to add their data to our website, and you can see them all on the map here. And like I said, we are really excited to be able to bring you all this data and to democratize data on health and the drivers of health for smaller and smaller places. Data should not just be for the New York Cities, the Los Angeleses, the Bostons. It really is what we're seeing just in the work that we've done over the last 6 years is that smaller and more mid-sized places are really the locations that could benefit the most from having this data available to them and for free. And so just a quick agenda. So we just did obviously, welcomes for our team, but I would love to learn more about who is actually here. If you can put your name and the city that you represent in the chat, that would be really helpful to just for me and Yuman to just learn about who's joining us. And then following that, we will talk about, dashboard, how to use the dashboard. I'll kind of give you an overview about how the dashboard was started and our mission, as well as a quick site demo. And then we will explore dashboard impact in other communities that were selected in previous rounds of the Put Us on the Map challenge. And then we'll close out with setting expectations for the year ahead on what you can expect from us and our team and what we hope that you will do now that you have access to your city's data. And so at the City Health Dashboard, our goal is really to help cities across the US and now cities really of all different sizes leverage the power of data to improve the health and well-being of everyone in their community. And we do that by providing over 40 measures of health and the drivers of health, then the drivers of health equity as of last month, 1,100 US cities. So any city with a population of 50,000 and larger is automatically included on our website, and a growing number of smaller cities through various initiatives like the Put Us on the Map Challenge are getting added every year. And so for us, the website was developed back in 2018, and we sit at the within the NYU Grossman School of Medicine Department of Population Health. So we operate out of an academic center, even though we are fully funded through the Robert Wood Johnson Foundation. But because that we are an academic institution, it was really essential for us to get real world city perspectives when we developed and launched and have managed the site over the past 6 years. So we wanted to partner with organizations like the National League of Cities or like ICMA, like NACCHO. These are organizations that have national memberships of mayors, city managers, city councils, local health departments to help inform, what are the best measures that we should be providing? How do we communicate about data? How do we communicate effectively about health and equity? And it is really having these perspectives in this feedback loop have helped us remain resonant and relevant to the growing and emerging needs and gaps and challenges that cities have faced. And it keeps our site, it keeps our site up to date. It keeps it visually appealing. It keeps it interactive in a way that makes sense for our audience of users. And so how do you actually use the City Health Dashboard? So hopefully you all have started exploring your data even a little bit since we added your cities in July. But I've highlighted here what I think are the three biggest use cases for the City Health Dashboard. So the first is to compare health gaps across neighborhoods. I have pulled out on this slide a neighborhood level map of life expectancy in Columbus, Ohio. And these three neighborhoods that I've pulled out or that I've highlighted are less than 2 miles apart, but residents living in each of these different neighborhoods has very different life expectancies that range of 20 years. So, in that leftmost neighborhood, someone can expect to live 60 years, while the neighborhood right next door, someone could expect to live 80 years. So the dashboard's really useful in helping people identify not only where gaps exist, but helping them take that next step into digging into what could be driving or causing those gaps. The next use case is the ability to compare your city with cities in, other regions, cities with similar population sizes, similar demographics, and we'll get into that a bit more in our site demo. And then finally, the dashboard is a really useful tool for helping you set priorities and better target your resources, particularly when resources or time or capacity is scarce. The dashboard, like I said, it's free. You don't have to pay for it. All of the data is analyzed at the city and the neighborhood level. So you can just hit the ground running if you're, applying for a grant, or if you're looking to, have a health screening in a certain neighborhood, and you want to make sure that you're placing that health screening in the neighborhood with the greatest need. The dashboard is really helpful for helping you identify those things and set your strategy more effectively. And a quick note about measure selection criteria. Like I said, we provide data for over 40 different measures of health. But where does that data actually come from, and how do we choose the measures that we decide to present on the site? So the first is that all of our data comes from national data sets. There's a couple of reasons why we do this, and there's some pros and some cons to that. But the first is the ability to compare apples to apples. We provide obviously 1,100 data on 1,100 now cities on the site. And so we wanted users to be able to, so we wanted, if we're looking at poverty, we wanted poverty to be, the definition of poverty to be standard from city to city, place to place. And so you would be able to compare apples to apples if you wanted to look at poverty in Bainbridge Island versus poverty in Texarkana, Texas. So what's good about national data sets as well is that all of our data comes from well-trusted federal data sources like the American Community Survey, which comes from the census, the National Vital Statistics System, which has all of the birth and death records in the country, as well as sources like the CDC's Places Project. One con of using national data sets is that the data is not local. It is collected obviously at the national level. And so you're not able to see really small local fluctuations in data based on, a policy that you might put in place or a program that you might implement. That data comes, you're only able to see those things through data that comes from locally collected data, like a survey that you might want to implement. We do not provide that local level data on our site. All of our data and all of our data sources have to exemplify really the most rigorous methods in data collection. Like I said, we operate out of an academic institution, so that integrity is really one of the most important things to us. And what that means for you is that you know that you can trust the data that we provide, you can trust what we're doing with the data, how we're analyzing the data, and that it's really meeting the highest standards for data analysis. And then moving into the bottom four is that we didn't want to just like put data out there for data's sake. We wanted the data that we presented on the site to really reflect the public health priorities that cities cared about. And so as our site has grown over the past 6 years, so too have the public health priorities. And our data has changed to reflect those changing priorities. So, back in June of 2020, we added a COVID measure that looked at COVID risk. And then once that public health emergency ended in 2023, we made the decision to remove that data. So you can always trust that the data that we are providing should reflect and meet the growing needs of cities. And then the metrics that we provide have to be amenable to city level intervention. Like I said, we didn't want to just present data on anything. We wanted city leaders to actually be able to move the needle locally using the data that we provide. Also, our data is updated regularly. We typically have an annual schedule where we update every single metric, and we have multiple data releases every single year. And then also our data is balanced over 5 overarching domains, which I will get into in just a moment. And so what do the selected Put Us on the Map cities get? First, you get access to all of your city's data on the City Health Dashboard website and all of the features that we provide. Like I've said a couple times now, all of our data is free. All of our features are free. There is nothing that is hidden behind a paywall. You don't need to, create a username and login. Everything is free and accessible as long as you have an internet connection. And now that your city's data is on the site, as we have future data releases, your city is always going to be included in getting the most updated data available. You don't have to reapply every year. Everything will always be, your city will always be included on the dashboard from now until forever. The second thing you get is support from the dashboard team. So if you have any questions or concerns about how to interpret something on the site, how to use the data, please, please, please email us or find a way to contact us with those questions. We are happy to help you. We are happy to do, demos or presentations for your staff or your community members. So just let us know. And then finally, we love featuring real use cases and local examples or examples of how our data has been used locally. And so if you're interested in, getting featured in a blog or an impact story, we would love to showcase how you're using the data. And so this next slide there's a lot of information here, but this is all of the information or all of the data that we have or all of the metrics that we provide on the site. So like I said, we have 40 plus measures that are available for our cities. However, for the smaller places, some of our data sets don't provide data for smaller places under typically sometimes 66,000, and then other times 50,000 is their threshold. So the measures that you see here in gold are available for your city in addition to all of the cities, and the measures that are listed here in gray are not yet available for smaller places. That being said, it doesn't mean that those data won't be available to you in the future. So like I said, we have data releases every single year. And so as we make more data pulls, so for example, when we pull data from the National Vital Statistics System, we have to go into like a locked room to pull that data. But now that we have your cities on our site, the next time we go to that, data collection center, we will pull data for the smaller places. So you can expect to see in future data releases more of the health outcomes data that are currently in gray. And so the measures, like I said earlier, are balanced over 5 domains. So the first domain is clinical care. Then we have measures related to the physical environment, health outcomes, health behaviors, and then finally social and economic factors. So it's really important for us to take that 360-degree view of health and population health. And we really place equal emphasis on those social and economic drivers of health as we do on our more traditional health measures like diabetes or life expectancy or obesity. And so digging into the site just a little bit, we can explore a little bit of the website in real time. So when you go to the cityhealthdashboard.com, you're just asked to put your city in the search bar. And so I'm interested in exploring Texarkana today. And you will be met with this metric selector pop-up. So if you know what measure you want to explore on the site, you can see the full list of dashboard measures here, and you can click into any of them. And you can see, we have a lot of updated tags or new tags to tell you that, oh, this measure was recently updated or recently added. But let's say you don't know what measure you want to dig into, or you just want to explore a more high-level overview of what's happening in your city. You can select this View Texarkana, Texas Overview. And this will take you to the metrics overview page. So you'll be able to see at a glance how your city or any city is performing on all of our measures. So you can see here, which measures we do not have available for that city. But then you can also see we have a lot of measures that are available, and you can click into any of them to learn a little bit more. So you'll see, a thumbnail image of the map. You'll see how we define the metric and a definition of the metric. You'll see the data source and the years that we have available. And you can click into the map or see metric detail to dig into that measure a little bit more. I do want to just also flag what I think is an underutilized part of the site, but is one of my favorite features of the site, is this demographics overview and demographics by census tract. So we have really nuanced and disaggregated racial, ethnic, and age categories for each of our cities. So you can see, if we're looking at this overview, the percentage of all of the different racial ethnic groups that are available for that city. So if we're looking at, for example, Hispanic or Latino, you can kind of dig into how much of the Cuban population lives in the city, Puerto Rican, and then we dig even further into Costa Rican, and all of these different subgroups. We also can show that by census tract. So you can, maybe we'll put in 65 plus here. You can also do this with all of the race ethnicities that we do have available for that city. So when we add the racial, or when we add the demographic group, sorry, if I can just move the map a little bit, you can see on this map here the different concentrations of the demographic groups that we have for your city. So the deeper greens tell you or tell you which neighborhoods have higher concentrations of that demographic group. So this census tract in Texarkana has 25% of its residents identifying as 65 plus, whereas this census tract only has 8%, or roughly 8%, who are seniors. And so going to the metric detail page, I'm interested in looking at routine checkups, for example. So you can see, again, some more information about the measure, how we define it. For 99% of our metrics, we have multi-year data available. And so if multi-year data available, you will be able to toggle between years by clicking on the year here. So we are now looking at the routine checkups for 18 plus in 2021 in Texarkana. And so one of the great things about the dashboard is that when we designed it, we really wanted to cater to a wide or a diverse group of audiences, of users who were really could be anywhere in their data literacy journey. So we wanted to be able to appeal to folks who are very beginner or who don't feel comfortable with data. But we also wanted to appeal to the PhD student, the epidemiologist. And so on our site, there's a whole bunch of visual signposts that tell you or orient you to what you are seeing. And once you kind of get your head wrapped around the way we visualize or communicate about data for one measure in one city, you know how it works for any city, any metric, any year. So we use like very consistent symbols and visuals and words to describe what's happening in every city. So here you can look at routine checkups. Texarkana had an estimated 73% of adults report visiting a doctor for a routine checkup in 2021, compared to an average of 71% across all of the dashboard cities. So we say that in plain English, but you can also see that exact same information presented here visually with this scale bar. So this scale bar represents the range of values for a metric. And our colors, the color scheme kind of tells you the direction of better outcomes. So for all of our measures, lighter colors indicate better outcomes and deeper colors indicate poorer outcomes. And this blue check mark in the circle will tell you the direction of those better outcomes. So for example, routine checkups, you want more of your residents who are seeing a doctor on an annual basis. So the lighter end of the scale bar will be on the higher end, whereas for a measure like children in poverty, you want less of your children experiencing or living in poverty. So those lighter colors would be on this side of the scale bar. On the lower side, this navy triangle tells you the dashboard city average. It's similar to a national average, but because it's only the cities that are included in the dashboard data set, it's not a one-to-one comparison to a national average, but it's a good proxy. Then this gold bar tells you the city or the census tract value of that metric. So in this case, Texarkana has roughly 73% of its residents or its adults who are seeing a doctor every year for a routine checkup. And that's compared to 71% for all of the dashboard cities. And this green check mark here will be present on the site when the city value is better than the dashboard city value. And so if we just hide the key here, we can dig into the map. And so again, like I showed you on the slides in the PowerPoint, you can see a map, a neighborhood level map of this metric for Texarkana. And each one of these census tracts is akin to a neighborhood. We use those terms interchangeably. Sometimes it's a better match than other times, but generally census tracts are good approximations of neighborhoods. So you can click into any one of these census tracts to see what is happening and what their performance is. And you're, able to see at a glance which neighborhoods are maybe doing really well and which neighborhoods need a little bit more help. And again, you can see these two neighborhoods here. You have this one on the right has pretty low percentage of routine checkups at roughly 70%. And the neighborhood right next door has an average of 76%. You're also able to star measures or star census tracts if they're of interest to you and you want to come back to them later. And when you star census tracts, they get saved here. And you're also able to, I love this new feature. You can highlight measures or census tracts or neighborhoods on the map. And if you highlight or save neighborhoods, this will be saved. So if you decide to go to a different city and then come back to, Texarkana, you come back to the city of your original choice, you will see these same census tracts highlighted. If you decide to leave the dashboard and then come back, they will still be saved for you. So that's a really cool feature. Then moving across this navigation bar, as we call it, is the demo detail page. Not all of our data has demographic detail or demographic level data available for it, but I will choose one that does. So you look at children in poverty. And so you can see, again, at a glance, how different racial ethnic groups compare to each other in your city for any specific measure. So usually the measures where we don't have neighborhood level data available, we will have racial, ethnic, age, or sex data available. And this just allows you to take a racial equity or just an equity, health equity lens to the dashboard and to the data that we provide. We didn't just want to provide that geographic lens. We wanted users to be able to take a more well-rounded equity approach to our data. And so you can see the different racial ethnic groups here, then comparing cities. So like I said, all of our data comes from national data sets, which allows you to compare your city's data to a city, another city in your state, a city in a different state. And we have a couple of ways that you can do that. The first is just typing your city into the search bar. Perhaps I want to compare myself to El Paso, another city in Texas. I can just type it into that box, and then El Paso's scale bar for that measure that you're looking at will be pulled down below your original city. So you can see here in El Paso, 25% of their children are living in poverty compared to 27% in Texarkana. If you don't know what city you want to compare yourself to, we also have this filter, or the city finder, which helps you find peer cities based on criteria or characteristics that matter to you and your work. So perhaps that's population size. So you can see all cities that fall into this 0 to 55K band kind of pulled down here. Or maybe cities in a similar location. We can do, let's just say, adjacent states. Let's see. So as you click more and more characteristics, the city list of matching cities to those characteristics kind of gets whittled down. So we started with 290 and now we're at 6. And so you can click, maybe Patterson, Louisiana, Alma, Arkansas. And as you click all of those cities, they too will be pulled down below Texarkana. Then comparing metrics. And, as the folks on this call know, a lot of these issues that cities are dealing with, be it poverty, housing, life expectancy, these are really, really big, complex topics, and they don't exist in a vacuum. And so we wanted users to be able to see how two measures may or may not move together in their city or be related to each other or associated with each other. And sometimes they won't be related, but we wanted users to have that flexibility. So you can select a different measure or a comparison metric here. Maybe I want to look at, so we were looking originally at children in poverty. Maybe I want to look at obesity. And so as we, once we choose that measure, you can see the map again of Texarkana, where the base map, or those blues, those blue polygons represent your original metric. So in this case, children in poverty. And then the red or the pink dots represent that second measure. So in this case, obesity. And again, lighter colors indicate better outcomes, deeper colors indicate poorer outcomes. And for both of these measures, lower numbers are better outcomes. So you can see in these neighborhoods where there's less children in poverty, there also tend to be less people experiencing or being diagnosed with obesity. And in these neighborhoods here where there's higher poverty, there also tend to be higher rates of obesity. And you can click into any one of these neighborhoods to see the estimates for both of the measures. You can also see this data presented graphically in this scatter plot. It's hard to see the associations here in a scatter plot for a small city because there's just not as much data to show you the actual association, but you are able to see, how these measures compare to each other on a graph. And so each one of these dots represents a census tract or a neighborhood, and you can click into those and again, see those estimates. Just want to make a quick caution, as I have here on the slide or on the website, just because two measures may be correlated does not mean that one causes the other. So that's very important for us to kind of hone in on. Then moving to a couple different features of the dashboard that I think might be of relevance. So the first is the take action section. When we created the site, we got a lot of feedback that, users were, really jazzed to see, the data presented for their local community. But they didn't know how to actually put the data into action or put the data into practice. And so we have created what we call the Take Action section or the Take Action Center, which has, a collection of roughly 500 different resources that are broken out into these 5 different buckets. So the first bucket is the what you can do. These are the policies and programs that have been proven to move the needle on various different metrics. So you can put in children in poverty or any metric that we provide data on, and you'll see a list of different programs and policies that can, press the wrong thing. You can see a list of different programs and policies that you can implement in your community to maybe move poverty rates in the right direction. You can also find partners on our dashboard. So, if you need to contact your elected officials or perhaps find your local United Way or your local YMCA, you can do that here. We have resources or tools that help you communicate about data to your local community or communicate about the social determinants of health to your local community. We also have things to help you find grant funding and actually help you apply for that grant funding. And then finally, how do we know that the outcomes or the outputs that we're expecting to see through our program and policies are actually being felt and experienced by the communities that we're hoping to serve through those programs and policies? So we have a lot of different resources that help you actually measure your impact. And then accessing dashboard data. I'm so sorry. This should be, I must have, cleared my browser history, but the dashboard has all of our data is available for download for free. So if you want to do your own sort of analysis or dig a little bit deeper into the data, you have a few ways to do that. The first is through downloadable CSV files that we have. You can either download the full dashboard city data set, or you can download these files by state, and then you can filter for your city. The downloadable CSV files only have the most recent year of data available, but for more experienced data users, we do have an API. Don't ask me how to use it, but you are able to make more nuanced data pulls or do more nuanced analyses using the API. And in the API, that does have all of our multi-year data available. And I believe Yuman just put that into the chat, so thank you, Yuman, for doing that. And you can access that from this main menu. And you can also, I'll get a little bit more into impact stories in just a few moments, but you can also access, we like to keep a record of how, well, we love hearing how local communities are using the data. And in addition to that, we love publicizing how local communities are using the data. Not to toot our own horn, but because a lot of users want to hear what's happening in other cities to help them maybe implement a similar program, or they can get an idea sparked. If this community is using data for grant applications, I should try using data for grant applications, and maybe that'll help my application stand out to the funder. So we have a whole repository of what we call impact stories or use cases of City Health Dashboard data, which is really cool to see. And this is like a growing part of the website. We're adding new impact stories, maybe not on a monthly basis, but every few months, more and more are being added. So you can see all of those here. And so moving back to the PowerPoint, it's a great segue. How are local communities using dashboard data? And so we wanted to show you how previous winners of the Put Us on the Map challenge have been putting data to work locally. So I actually won't go into this just for the sake of time. This is like a little video we put together of users who just shared, how the dashboard has been useful to them in their work. But I for the sake of time, I won't go into that quick video. Because I want to leave enough time for questions. So first is Marietta and Belpre, Ohio. These are two cities that are served by the same health department. So it's been really hard for the city or for the health department to get data on both of these cities. And both of these cities are small, so it's been even harder for them to find data that kind of explains what's happening in their jurisdiction. So we had a representative from the local health department apply on behalf of these two cities. And so they've been able to use the disaggregated racial ethnic data in their application to become a nationally accredited health department, which has since been accepted. And so now they have all of the same perks as a health department in the New York City Health Department by having that national accreditation. And so data on racial ethnic data, but also our metric data was really essential in helping them apply for that accreditation and really showing the Public Health Accreditation Board that they knew what was happening in their city, that they were able to identify gaps in equity, and they also have used our data to implement a community health assessment and a community health improvement plan, which is something that health departments have to do every 3 years. And you need strong data collection or data available to you to do those sorts of assessments and improvement plans. Next is, Decatur, Georgia. So Decatur applied to the Put Us on the Map Challenge last year. And since getting access to their data in 2023, they have done some really cool work at the fire department. So historically, the fire department has used heat maps to illustrate or to kind of show the geographic distribution of its EMS response. So that's responses to cardiac arrests, to overdoses, to diabetes complications, but they weren't really taking an upstream approach to that work. It was very just like, it was very kind of like on defense. They weren't playing offense with these with their emergency response strategy. And so the dashboard has broadened their perspective on what those factors might be that could influence the more downstream events that they were receiving calls for. So they kind of put their heat maps together with our data on various things to get a better understanding of where they can target their prevention in those higher need areas. In Maplewood, New Jersey, they identified some pretty clear-cut health disparities in different neighborhoods across their township. And so they have launched a whole suite of new health interventions and have re-strategized existing programs to better meet the needs of residents. And what I mean by that is, for the past, at least 5 years, they've been holding these health fairs in one neighborhood that they had discovered actually had really good positive health outcomes, and they weren't seeing uptake from folks who are living in higher need neighborhoods actually attending the health screenings in those higher outcome neighborhoods. So by being able to identify where higher need neighborhoods existed, they have then pivoted and moved the location of these health fairs to these higher need neighborhoods, and over the course of 1 year have seen a huge shift in who was attending those health screenings, and they have been able to really increase the number of residents who are at higher risk for various different health challenges, attending and getting seen at these screenings and getting connected to doctors across the community. They also included dashboard visuals in a successful grant to the New Jersey State Health Department to get and substantiate the need for increased health or increased funding for their programs, for their staff, over the last year. So that's really exciting. And then these are just two more use cases from two cities that were accepted in 2022. So the first is from Hillsborough, New Jersey. They targeted a lot. I mean, this kind of sounds a little bit outdated now given the state of COVID, but they use the dashboard to target their COVID education, their vaccine outreach, and where they distributed free COVID testing by using the dashboard's COVID risk index, the preventative services measure, as well as the uninsured measure to identify high need neighborhoods and really target where they were doing outreach. And then finally, Petersburg, Virginia has used the dashboard to increase their access to healthy foods and have put together our data with locally collected survey data to decide where to place mobile farmers markets to make sure that neighborhoods that were considered food deserts were actually getting served by these mobile farmers markets. So those are just a few different use cases, and I'm happy to answer any more questions about these use cases in the Q&A. And then just quickly moving forward to what you can expect from our team. So I kind of went into this in the beginning, technical assistance. If you need help, navigating the site, or you need help interpreting the data, or you have geography questions, please reach out to us. We're here to help you and support you use our website. If you need help in the communications sphere and you need help talking about the social determinants or talking about data, or if you want to highlight all of this new data that you have for your community, but you don't know where to start, call us, reach out to us. We do these sorts of presentations all of the time. And so we can help you think about how you can communicate data with your residents or with your organization or with your city. Networking with other communities. If you see on the dashboard that, Grand Rapids is doing something really cool with the data and you want to be connected to someone in that city, we'd be happy to make those connections. And then finally, best practices on data sharing within your community. We have a trove of best practices that we can that we would love to share with you. So if that is something that you need, you can count on us. And then next steps, just explore the data, see what's there, share it with your community, reach out to us. I already, have said that, quite a few times, but I have put my email on the slide. And if you wouldn't mind putting my email in the chat, though I think I've emailed almost all of you now, hopefully, so you have that in your inbox as well. And then just keep us updated with your correct community context and how you're using the data. Someone already emailed me saying that they want to add someone to the mailing list. So if you have kind of staff turnover, let us know. And we can just kind of move on to the Q&A with the last 15 minutes. So I will stop sharing and I will see what questions we have in the chat. Okay. No questions in the chat, but if you have anything, feel free to take yourself off mute, write it in the chat. That's totally fine. Whatever works for you all is good with us. Okay, if there's no questions, I'm not seeing any come through. You can feel free to, don't need to take up the whole hour. You can feel free to hop off. If you're a little bit shy and want a smaller group to ask your questions, myself and Yuman will stay on for the next couple of minutes. But thank you all so much for not only attending this webinar, but for actually applying to the Put Us on the Map challenge. And making the case for using data. And we really look forward to working with you all over the next year and seeing how you put the data to work.